Let me explain the Bale-Doneen method to you. The Bale-Doneen method is a method of practicing preventive cardiology developed by doctors Bradley Bale and Dr. Amy Doneen to look for the underlying inflammation which causes atherosclerotic coronary disease. It's based on an eponym that they use called EDFROG. E stands for education because it's so very important that the patient buys into the knowledge of how the atherosclerotic process develops in order for them to play their significant role in the prevention of the atherosclerosis. The D stands for disease. We look very hard for evidence of atherosclerotic disease. We don't wait until you show up with an event. We're looking either with coronary artery calcium scores or carotid scans to see if you have evidence of atherosclerosis, and if you do, then we're going to work very hard to treat that atherosclerotic process. F stands for fire, and the fire in the Bale-Doneen method is inflammation. There are a multitude of disease states which can cause inflammation in the arteries. We look for those disease states. If you have them, we're going to treat those underlying disease states in order to prevent the inflammation in the arterial wall. R stands for root causes. There are a number of underlying disease states which can cause inflammation, such as obstructive sleep apnea. Certainly hypertension and diabetes are inflammatory states, but also insulin resistance, periodontal disease, endodontal disease. O stands for optimal. We're going to treat every single person as an individual. We're not going to treat you as part of a group based on a risk score, but rather we're going to look for your individual problems along with the G for genetics, and look at your particular genetic makeup because it's going to play a role in therapy. So the big difference with the Bale-Doneen method versus the standard of care cardiology is that, as Amy Doneen likes to say, it's unlike our legal system. We're going to assume that you are guilty. We're going to assume that you have atherosclerotic coronary disease until we can prove that you don't. And once we find that disease, if it's there, we're going to work very hard to find the underlying inflammatory cause, treat that underlying inflammatory cause, and then slow the progression, halt the disease process altogether, and even in some cases regress the disease process so that you will not have that event.